2020. This is a media briefing today from the Hamilton County Health Department. The individuals that will be speaking today are Tammy Burke, Bill Ulmer, and Alexis Edwards will be talking to you about the updates, and then we will open it up for questions. This time, let me introduce to you Communications Chief Tammy Burke.
Thank you, Amy. Hello, and thank you for joining us today. The Hamilton County Health Department reports one new case of COVID-19 today, for a total of 98 cases. Unfortunately, we must also report another death related to this virus, bringing total deaths in Hamilton County to 10. This death was of an adult with underlying health issues. We send our deepest condolences to the family. The Hamilton County Health Department understands that every citizen has personally been affected by the COVID-19 pandemic, whether emotionally, physically, psychologically, or financially. The staff of the Health Department shares this burden with county residents. This holiday weekend reminds us all, regardless of individual beliefs, to cultivate the gratitude for what we have and to find the strength to continue until this pandemic ends. At this time, I'm going to turn it over to Bill Ulmer, our Director of Community Health Services, who is also heading up our COVID-19 faith-based resources. Bill will be followed by Alexis Edwards, one of our public health educators, who is now working on the hotline. Thank you.
Good afternoon. My name is Bill Ulmer, and I am Director for Community Health Services here at the Hamilton County Health Department. Our health department places great value on the importance of our faith community, and we look forward to our faith-based leaders to reinforcing and supporting the approved guidance of CDC to help us stop the spread of COVID-19 within the communities that are being served. With observances of Easter, Passover, and related religious celebrations quickly approaching, we want to encourage pastors and other leaders of our faith communities to conduct celebrations in the safest ways possible. This means consider virtual services such as streaming, the use of Zoom communications or other web-based conferencing services, automated text messaging, airing previously taped services for those who have broadcast ministries. Extend the use of your website to disseminate celebratory information and guidance, as well as other social media platforms. In that we know and appreciate the relationships our pastors and other faith-based leaders have with your congregations and the community, we especially ask for your leadership and your help during this stressful and challenging time to offer a comfort and assurance to our seniors, to those who are out of work, those struggling to pay their bills and struggling to put food on their tables, as well as those who are displaying anxiety, frustration, and hopelessness. Now is the time when we look for our partnership with you, the leaders of our faith community, to calm fears, hopelessness, anxiety as we get through this difficult time together. In keeping with Governor Lee's and Chattanooga Mayor Burke's and Hamilton County Mayor's recent executive orders, please do what you can to encourage everyone to stay home and stay safe. Please continue to practice social distancing, and that is increasing the space between individuals and decreasing the frequency of contact with others to reduce the spread of this virus. Again, stay home unless it is absolutely necessary to leave. Avoid close contact with people who are sick, and then if you are sick, stay home. Wash your hands with soap and water often. Use hand sanitizer if soap and water are not available. Cover your cough or sneeze with your sleeve or elbow or tissue and then discard that tissue immediately. Clean and disinfect frequently touched objects, and then stay informed using reliable informational services. Know that while observances and celebration at this time of year are important to all of us, please help us to reduce the spread of this virus so that we all can eventually return to the traditional worship practices we so humbly embrace. Remember that our faith leaders, our congregations, and assemblies, as well as the community at large, are invited to visit the Health Department's webpage for more information at health.hamiltontn.org and our Facebook page. Also, you may call us at our hotline. Our number is 209-8383.
Good afternoon. My name is Alexis Edwards, and I am a public health educator here at the Health Department. For the past few weeks, I've been working in our Health Department's COVID-19 hotline to help answer questions from the community. Today, I would like to talk about some of the most common questions we hear from people who call and share our responses. I'd also like to mention that our hotline is open every day, and we will be open over the holiday weekend. The hotline number is 423-209-8383, and we are there Monday through Friday, 8 a.m. to 6 p.m., Saturday, 10 a.m. to 3 p.m., and Sunday, 10 a.m. to 2 p.m. Now I will go over some of the most common questions we receive. One of the questions is, how do I get tested? We ask the caller if they have a primary care physician, and if they do, we ask them to call their doctor. If they don't have a doctor, we recommend they call an urgent care or community clinic, and we remind them of the importance of calling ahead and making an appointment before showing up. If the caller doesn't have health insurance or a doctor, we provide additional guidance. People also have questions about business compliance with the state and city executive orders. If people have a question or complaint about a restaurant, we send that information to our environmental staff. If people have a question about a business outside of the city of Chattanooga in the county, we also send that information to our environmental staff. If people have a question about a business located in the city of Chattanooga, we refer them to 311. And for serious concerns from employees of businesses, we refer them to the Tennessee Occupational Safety and Health Administration, or TOSHA office. Another question people ask is where they can get supplies like gloves or masks. We tell people to call grocery stores or pharmacies before going to see if they have supplies in stock, and we share CDC information about making cloth masks. We let people know about community resources like the United Way and 211. Those are just a few of the questions people ask us in the hotline, and we want you to know that we are here to help answer your questions. If we don't know the answer, we will do our best to find the answer for you or direct you to someone within our department who knows. Again, the hotline number is 209-8383. Thank you.
Okay, we're going to open it up for a few questions. Sarah Grace Taylor.
Yes, can you tell us what the age range of the recently deceased patient was?
Yes, and if you've noticed, our website has now been updated with age bands in decades because our case numbers warranted that. All of our deaths so far have been in the, except for the one pediatric death, have been in the age range of 61 to 81 plus.
Thank you.
Shannon Sharp, Channel 9.
Hey, so hold on, let me pull up my notes real quick. Sorry, I lost my spot. On Monday, y'all said that y'all are doing 75 tests a day. How many tests have we done as of today?
Martha Road, 629 Martha Road, Cross Benderson Cemetery Road, and dead end.
Sir, are you asking how many tests we've done?
That's correct.
Yeah, what was the amount of tests that were conducted today?
That have been conducted today at our testing facility, the drive-through
Okay.
site.
Sure, that one and Baylor. The drive-through side is fine, or if we're running tests through Baylor,
Okay.
I'll take that number too.
Okay, the test, let me just explain that. At our drive-through testing site, we are obtaining the specimens to do the testing. And we are averaging about 50 tests a day, specimens taken. At the Baylor lab, they are actually testing the specimens for the virus, and they are averaging about 60 tests per day.
Sarah Grace, you're up again.
What days is the drive-through center open now? At one point, it was only 3 days, but it seems like it's been more than that this week.
Right. This week we have operated 4 days. Today is our last day this week to operate. We'll operate 5 days a week beginning Monday.
Thank you.
Shannon, is your hand raised again?
It is, yes, ma'am.
Okay.
Yesterday, the mayor said local hospitals got bumped from receiving their supply of rapid tests, and that it would be until May until they receive those. Does the health department have access to any of these Abbott rapid tests or the machines to process them?
We do not have access to that at this time. Certainly, when the time comes that those would be available to our area, we will certainly get those in place as soon as possible. But those are right now being diverted to areas of higher morbidity and mortality than we have here.
Sarah Grace? Sarah Grace?
Responding.
Yeah. Is there any update on the additional equipment to handle more tests in the Baylor lab?
There is no update on that I'm aware of. The equipment is still has been ordered.
Shannon, is your hand raised again?
Yes, ma'am.
Okay.
Just kind of a follow-up to that question about the Abbott rapid tests. Why are private walk-in clinics able to get them, but the hospitals and health departments are not?
I can't specifically answer that question, but I can tell you that the Abbott rapid test for COVID-19 uses the same technology that some walk-in or ambulatory care centers currently have in place to test for things such as influenza. And it may be that it's the actual testing equipment and not the supplies that are being diverted to places of high morbidity and mortality at this point. But I don't have personal information on that. That is just what I'm understanding based on what I've read.
Thank you. And can I ask a follow-up question to Sarah Grace's question about the drive-through testing? Are you able to test anybody with without a physician's referral, or are you turning people away?
We are only testing people who do have a physician's referral. And the reason for that is we want to ensure that if we get a positive test back, that the person has a healthcare provider to give them the follow-up care that they will need.
So everyone who comes to the physician's referral is able to get tested?
Everyone who comes to us with a physician's referral will be tested.
Thank you.
Callie Starnes?
Hey, Amy, thanks. I believe the number that was given in terms of average tests at Baylor School was 60 a day. I know the doctors over there originally said that they were capable of a capacity of 300 eventually. At what point do you foresee getting 300 tests to them a day to test? And do we need that kind of capacity in our community?
First of all, they will be able to test at that capacity with the equipment that is on order right now. I don't think that we can determine at this point what the testing needs will be when that equipment gets into place. If you're asking today, could we send them 300 tests to do? That is not the case today. But as you well know, with this pandemic, every day brings new information.
Thank you.
We'll take two more. Sarah Grace, are you there? Sarah Grace Taylor, are you there?
Can you hear me now?
Yep.
Okay. My other question is just, does the health department have any new information on when they can expect a peak locally?
What I can tell you about that is because we have seen COVID disease enter our community somewhat later than it has other areas of the state, we anticipate that we will reach our peak somewhat later than the rest of the state. But as far as when that will be, I don't have information on that.
Last question goes to Miss Shannon Sharp.
I'm done. I'm good. Thank you.
Oh, you're good? Okay. Who? Jake from Channel 3?
Yes, hi, can you hear me?
Yes.
Okay, so we actually had someone reach out to us that said that he has a doctor's note and everything to get tested, but you guys wouldn't test him. He says that he had to fax, the doctor's office had to fax his letter to you guys, but the doctor's office says that's not their policy. So why can't you test him if he already has a doctor's referral to be tested for the virus?
The way we are operating at this point is there is a referral process that all physicians or healthcare providers must go through and contact us themselves to order the test. It's very similar to if you go to your physician and they want to order a mammogram or an MRI, they typically will have a scheduler call you after that visit and work out the time that you can go for that service. And it just creates a better coordination between the physician's offices and the health department and the testing facility.
So even if he was able to have that note and say went to the drive-through testing site, you couldn't do that test for him, even though he has a physical copy of this referral from a physician or doctor in our area.
That's correct. The health department must speak with the physician's office and make that appointment for the individual and then contact that individual and let them know when their appointment time is at the drive-through facility.
If it's okay, can I ask just one more question?
Go ahead, Jake.
Okay, so we are getting word that, our surrounding counties, Sequatchie and other counties are going to be doing testing without referrals. Are we going to get to a point here in Hamilton County where you guys will be able to test people and they don't need a referral from a doctor or physician?
Well, again, this is an ever-changing pandemic, and so certainly if we determine that in our county that need is there, we will pivot to respond to that need.
Okay, thank you.
Thank you, Tammy. This concludes the media briefing for the Health Department on Thursday, April the 9th. We want to wish everybody a good Friday and a happy and safe Easter. Thank you so much.